Hey Katie, it's Chris here. I forgot to make you this short video to tell you a little bit about my story and what I'd like to do as far as my spinal cord injury is concerned. It is 8 months from my spinal cord injury. It was a T7, T8 spinal cord fracture. Also fractured my C3, broke my right shoulder, all 10 of my ribs on the right side, tore my ACL and my PCL on my right knee. As of right now, I walk and work, drive, do everything like before, except that I need to have ACL surgery here soon to hopefully get back to normal. But my recovery is not very typical whatsoever. A lot of people call it a miracle. I work really, really hard, 24-hour a day, 7-day a week job, just on recovery, basically. Exercising, and I'm contacting you because I think that my story and my experience can help people like me who was told that I'd never walk again. I was told in the hospital there'd be less than a 1% chance that I'd ever walk again, that my parents were basically going to inherit a 30-year-old child, and I used my knowledge of fitness and health and the knowledge of my peers and my friends to basically incorporate a lot of techniques that are not very conventional. In the hospital, you go through basic rehabilitation, which is here's your wheelchair, here's how to function in your wheelchair, self-care, skin care, how to use the bathroom, wheelchair accessible stuff, and not much in the range of recovery, especially what's called recovery below injury. I incorporated a lot of weight training, standing up as much as I could, holding on to things. I'd wait till the physical therapist left, and I'd use the physical therapy equipment. At night, I use the electrical muscle stimulator that I bought off eBay to kind of shock my muscles while nobody was looking, and really focused on the feeling I was getting from my muscles contracting from the electronic stimulation. I mean, and I would strain really, really hard to move, and I would get the tiniest bit of movement back, and I would facilitate that and work on it and hopefully manifest itself into a muscle contraction. I was able to do that with every single muscle. Long, hard recovery, but it's possible, and willpower and hard work and faith, and I used a lot of flexibility and massage. When you're paralyzed and nothing's moving, your muscles really tighten up, and a lot of lactic acid and dead red blood cells basically immobilize your body as much as paralyzing, you're immobilized. So I used some people with myofascial release technique, foam rolling. Before I could ever even move my legs, I had friends come into the hospital. They were actually massaging my legs, putting them through the range of motion. Even though the doctors told me it was basically useless, I would have friends make my feet move and focus on what that felt like and focus what I was doing and try to make that connection. And I don't think that I'm any different than anybody else. I just really wanted it really bad, wanted my life back. I continue to want my life back. My goal is to be back to as close as normal as I possibly can at the 1 year mark, and another huge reason I want to tell my story and bring the people that have helped me get to this point to the forefront, the fitness professionals, the massage therapist, the acupuncturist, is that spinal cord injury is known as the silent epidemic. The silent epidemic being that, as I look at these stats on my computer here, average cost of care is initial year for paraplegics such as myself is $500,000, with each subsequent year being $66,000 for the cost of care, and people just can't do it. What happens is that 80.6% of spinal cord injury patients are male. The average age is 28.7 years of age. There are currently between 327,000 and 450,000 persons in the United States with spinal cord injuries. Being it that the silent epidemic is that people have these injuries and they're given no hope of ever recovering, and they're given their wheelchair, and most of them go home and live with their parents, kind of slip away into obscurity, go live home with mom and dad and essentially become a child again, and live what small bit of a life they can, and nobody ever thinks that it can happen to them until it happens to you or one of your loved ones, and your entire life changes. I do know when I was in the hospital, my entire world shrank down to that hospital room and the short distance I could push my wheelchair, and that's a lot of people, I think, live that life as far as they can push their chairs, as far as their life is. And there's new instances of the new research, and it being 2013, and the ability to get on the internet and look up things. I'm constantly trying to learn. I was trying to learn throughout my ordeal of what I could do and to recover, and there's a huge push for recover below injury, for actual working out. There's programs like Project Walk that are unconventional, and people like myself who are actually getting better and are actually beating this disease as it is are few and far between, and I've actually encountered reaching out to people, to hospitals, to rehabilitation programs, to see if they wanted to ask me any questions, have any input, know about my recovery, and I'm basically told that I'm a miracle, and that I shouldn't give other patients false hope, that they need to accept it. And if I would have just accepted it and eaten the Valiums and the Xanaxes and the pain pills and the crap they wanted to give me in the hospital, I don't think I'd be where I am today. I don't think there's anything as wrong with false hope whatsoever. There's no promise of a cure, but I think that anybody in their right mind would want to fight like hell to get as good as they possibly can. And if your life improves 1%, then you've made that 1% improvement. But to sit in a wheelchair and basically wait and see if something comes back, which is the advice that most spinal cord patients are given, it isn't living at all. So hopefully I can get my story out there. We can talk about the actual specifics of the training that I did and the training that I continue to do, and the way in which that others can live a better life, and maybe one more person can get out of that wheelchair. I stood up from the wheelchair on October 31st of this year, and I've never sat back down in it again. I walk unassisted, and I look forward to having this ACL surgery on my right knee so that I can live normal and get back to the athletic things that I love, and the reasons why I do what I do. And like I said, I don't think I'm special and magic, and I think that the miracle of my story is that God gave me the strength to get out of that bed that first day and put both feet on the ground and get started. But by no means did anybody wave a magic wand and heal me. It's been every second of every day. I mean, I focus on movement, I focus on breathing, I focus on stretching. I'm constantly conscious of where my body is moving through space and time, and it's been a commitment that has had a very positive outcome for me, and I really hope that I could share it with anybody to give hope and faith that if you want something bad enough, and if you're willing to work hard enough, that it's possible. So I hope this video finds you well, and if you want any videos of my progress or anything whatsoever, you can contact me and hopefully discuss this further and move forward and help some people with spinal cord injuries. So thank you.